We studied the frequency of LDL cholesterol testing frequency from before to after the release of the 2013 guidelines. And those revised guidelines did remove the recommendation of ongoing LDL testing in order to treat patients to blood cholesterol goals. And as you noted, we found very little, if any, impact of the guidelines on LDL testing frequency following the release of the guidelines. And so this could be due to lack of awareness or understanding among physicians. It's also possible that given that physicians are faced with a multitude of cholesterol treatment guidelines from varying organizations, sometimes or historically there are conflicts between those guidelines. There could also be disagreement or perhaps confusion over which guideline to follow, therefore leading to unchanged rates of LDL testing as observed in our study. We did overall find that rates of LDL testing were unchanged, and we explored multiple diverse patient populations, including patients who were initiating statins at varying intensities, patients who were starting ezetimibe, as well as patients who are at much higher cardiovascular risk, those who had recent hospitalizations for myocardial infarction or ischemic stroke. And in general, our findings were consistent. I will say that overall, over the course of the study period, generally adults who were older, who had more higher levels of risk for cardiovascular disease did have lower rates of testing, and that was in contrast to younger adults who are at lower risk of cardiovascular disease who in general had higher rates of testing.